This is similar to when we measured subtalar inversion, eversion in kinesis. We drew a line on the posterior midline of the leg, the distal third of the leg, and then also midline of the calcaneus. We put our goniometer there and we measured it, and we took them through the range of motion of calcaneal inversion or eversion, right? Remember that? Like it was yesterday, right? Okay. Subtalar neutral uses those same lines, the same goniometric alignment, but now we're trying to find what is the neutral position of this person's foot, all right? And the way to do that is, you're standing down towards the end of their feet, okay? If I'm doing his left leg, I use my right hand to palpate anteriorly the dome and the neck of the talus here, okay, in the front. My other hand is going to grab his fourth and fifth metatarsals. I'm going to bring him up into about neutral dorsiflexion, plantar flexion. Just hold that one up there for a second. Don't get your hamstring. Okay. So I'll hold here and here, and then my other hand hold on his fourth and fifth metatarsal. Okay, put him in neutral dorsiflexion, plantar flexion, and then I will supinate and pronate his foot. Okay. I will supinate and pronate his foot until I feel the talus equally on both sides into my fingers. Okay, so what does that mean? That means, okay, he's lying in this position. I'm going to hold my fingers right about here. Okay, so we know that when you pronate and supinate, okay, that talus is going to move. When I fully supinate him or invert him, where will I feel the talus more? On the lateral side or the medial side? Laterally, right, it's going to stick out on that side. So then I'll pronate him and it'll be sticking out more on the medial side, okay? So I take a big arc of motion, okay, and I feel it, I don't feel it as much on the lateral side, I feel it more medially, and then vice versa, and then I make my oscillation smaller and smaller until I feel that it's equal on both sides when I feel with my fingers. Does that make kind of sense to you? Okay? And then once you get to that position of that subtalar neutral, then you put your goniometer on there and you look at and you're measuring the position of the calcaneus, whether it's in varus or valgus. Okay, and that is that individual person's subtalar neutral position. That's where they tend to function from. That's what they think is either not pronated or supinated. It's right in between. It's normal to be in about 2 to 8 degrees of varus. Subtalar neutral normally is between 2 and 8 degrees of varus. That will allow proper functioning of their foot during gait for pronation and supination. If the person's subtalar neutral, okay, is in more varus, and that's what they think is, or their foot thinks, and their structure of their foot is neutral, and they're all this varus, what would you think about the structure of the foot? Is it a supinated foot or a pronated foot?
Supinated.
Yeah, it's a supinated foot. Okay, or vice versa. If you find that their subtalar neutral is actually 0, or some valgus, God forbid, okay, that person is a heavy pronator. All right, so this static examination, okay, can give you some information about where their foot functions from, sort of. All right? Now this can also be done in weight bearing. Okay, so come on, stand up for a second. Just face your class. Okay, and in this position, I want to see what's going on in weight bearing. Again, I put my hand anteriorly on there, except now I'll ask him to pronate and supinate. So I ask him to raise the arch in your foot for me, Shane, and that's really sort of supinating. And as he supinates, I feel it more here on the lateral side. Let your arch fall, flatten your foot, and I feel the talus now sticking out on the medial side, and then I'll have him make those oscillations smaller until I find where is the neutral position, okay? And then I can take my goniometer and measure that.
Where exactly your hands are on both sides?
It's on the same place they were before. They're here and here. Okay, right on the anterior aspect of the ankle and the sinus tarsi, okay, which is that anterolateral, and that anterolateral part, okay, and then medially and anteriorly, okay? And you'll feel your fingers will sort of sink in there. You'll take them all the way through supination, all the way through pronation, and then you'll feel it, okay? And then you make your oscillation really big in the beginning, okay? Feel for it, feel that motion, okay? And then make them smaller and smaller until you feel equal pressure on both sides of that talus. That's where the patient's foot is said to be in a neutral position, and it will be different for everybody. That's why it's a range from 2 to 8 degrees of varus being normal. But we sort of look at your patients and then sort of decide, is this valgus or varus?
You do this both, I don't know if you did it right now while standing. You do it both non-weight bearing and weight bearing?
I usually screen the patient in non-weight bearing if I'm doing my physical